This session is encompassing 4 different kind of hemato-oncologic diseases, so they are quite different. I would say for Hodgkin lymphoma, where we cure currently about 85% of the cases, the remaining challenge is how to avoid long-term consequences, which are represented by second tumors and cardiovascular complications. And this seems today possible using the so-called PET-guided treatment, in the sense that we can avoid 80% of the radiotherapeutic treatments by using a PET guidance in the early stages, and we can avoid a too intense chemotherapy also in 80% of the cases using a PET guidance in the advanced cases. So this is really a very important message to the community today. In chronic lymphocytic leukemia, where a lot is happening, the main message is that we are rather close to developing a curative treatment, which has been very elusive for forever till now. And but in the last 15 years, we have learned a lot about the biology of CLL. We have now new, very efficacious treatments. We have just to learn how to combine them, and different trials will be presented, which are just trying to show where we have to go in order to achieve the best combination and be able to devise a curative treatment. In multiple myeloma, again, like in CLL, there is a lot happening because we have a huge amount of new drugs which are efficacious. The main question here is can we avoid autologous bone marrow transplantation by using the new drugs? For the time being, not. There will be a trial presented which will show that autologous bone marrow transplantation is still necessary, but as the outcome with new drugs is improving every year, we will probably reach that point in the near future. But again, we still do not know how to best combine these new drugs. 4 trials which have been shown and will be shown are just giving some important clues, but we will need, again, a couple of years before we will exactly know how to combine these new drugs. In follicular lymphomas, there is, alas, nothing very new. There are a lot of drugs coming, but none which is really outstanding. The new monoclonal antibodies are not much better than the older one. So here in follicular lymphoma, the main message for the treating physician is, well, try to treat as little as possible the patients. Try to adapt your treatment to the biology of the disease. Sometimes it is necessary to treat, sometimes not. Our results are improving nevertheless. Today, the median life expectancy of newly diagnosed patients with follicular lymphomas is 18 years, and this even without new drugs, but just because we have learned how to treat the disease.